This is my fave body system, so I'm going to teach you a few key facts about heart meds. There are 6 major categories, all of them aim to ease stress on the heart and improve either blood pressure, heart rate, or both. Every single one of these will lower the blood pressure except for digoxin. We'll go over that one later. To lower BP, they all work a little different, act on beta receptors, the RAS system, calcium channels, or smooth muscle to allow for easy flow of blood. All medications come with side effects, so we want to make sure to monitor glucose, airway, and prescription of Viagra that can cause complications. And of course, orthostatic hypotension for all of these as well. The ones that lower heart rate are beta blockers and certain calcium channel blockers. If these lower the heart rate, we will not give these to heart failure patients. But we do give digoxin for heart failure. Let's go over this one. The purpose of digoxin is to improve contractility of the heart muscle, to dig for that forceful squeeze. This is huge for heart failure and dysrhythmias. We monitor labs and signs of toxicity with this therapeutic index. We can also give vasodilators and diuretics for heart failure to facilitate blood flow and prevent fluid buildup. These are all safe for pregnancy except for ACEs and ARBs, and lastly, don't stop abruptly.